Members of the board, my name is Rhoda Northbrook and I come from Cranston. I'm a retired registered nurse, so my concern is public health. So tonight I'm going to talk about diesel exhaust and public health issues. I'd like to talk about the additional truck traffic that will be brought to our local community. Additional truck traffic that will result from the delivery of water to the proposed power plant site in Burrillville. Although progress has been made in the past decade in reducing exposure to diesel exhaust still poses a substantial risk to public health and the environment. The International Agency for Research on Cancer classified diesel exhaust as carcinogenic to humans based on sufficient evidence that exposure is associated with increased risk for lung cancer. If the Clear River Energy Center moves forward to fruition in Burrillville, the diesel-fueled truck traffic will increase by thousands of additional trucks per month. The trucks will be traveling on an already heavily traveled, congested route to and from the site. The route is highly populated, consisting of homes, businesses along Route 44 through Smithfield, Greenville, Gloucester, and Burrillville. The most congested area is Route 44 in Smithfield. What about a traffic study? Has anybody thought of that? Well, Invenergy did a traffic study / report. However, they did not talk about residents or the businesses. Invenergy was only concerned about the traffic impacts of the diesel trucks and the width of the roads in Pasco. Along the route are 8 schools and preschools with approximately 1,197 children, 7 nursing homes with approximately 700 senior residents, 9 working farms that grow fruits, vegetables, and chickens. Anyone who has traveled this route knows about the narrow roads. On any given day, you will see people walking, you will see children playing along the roads, especially in the villages of Chepachet and Pasco. Long-term exposure to diesel exhaust can cause chronic respiratory symptoms, such as persistent cough, I'm hearing a few tonight, bronchitis, reduced lung capacity, and yes, kidney damage. Believe it or not. Children and adults with asthma and emphysema, heart disease, and/or allergies are especially susceptible, and the long-term exposure to diesel exhaust can cause symptoms to worsen. Children and the elderly are the ones to be affected the most. Diesel particulate matter is composed of carbon particles called soot, or black carbon. The soot is comprised of numerous organic compounds that include polycyclic aromatic hydrocarbons, benzene, formaldehyde, acrolein, and butadiene, just to name a few. All of these are known triggers towards the burden of cancer. The majority of the particulate matter from diesel fumes is small enough to be inhaled into the deepest region of our lungs. This is where the lungs are most susceptible to damage. Again, children and elderly are most vulnerable here. The diesel fumes will be in the air that we breathe, they'll be in the soil of our gardens, and the water that we drink. According to the World Health Organization, it has been reported that diesel exhaust is more carcinogenic than secondhand smoke from cigarettes. The report goes further to state that diesel exhaust belongs in the same deadly category as asbestos, arsenic, and mustard gas.
Thank you. Mary Jean Davis.